Good afternoon. I'm Dr. Dale Bratzler. I'm the University Chief COVID Officer here at the University of Oklahoma. I'm here to do the weekly update on some of the information that we have available on COVID-19 in Oklahoma. So most of you are probably already aware there were 794 new cases that were reported today. So we're up just under 47,000 confirmed cases in the state of Oklahoma. Another 11 deaths that were reported. So we're at 644 deaths in the state. And in the past week, we've had 44 deaths, and we're just under 4,642 new cases that have been confirmed this week. We will be sending out some handouts that highlight the case counts in Oklahoma. Right now, the good news is that the 7-day rolling average of new cases in Oklahoma continues to decline. As of today, we're seeing on average 663 new cases that are being confirmed daily. Remember, 2 weeks ago, we were just under 1,100 new cases per day, so that's a very encouraging trend. The other trend that I've been watching very carefully is the percent of tests that are positive. And through the first 4 days of this week, 50,000 tests have been run this week in Oklahoma, and of those, 8.9% of the tests were positive, which is substantially down. We were consistently running 10.5 to almost 11% a few weeks ago. So the percent of tests that are positive has come down, which I think is an early marker of many of the public health interventions that are happening around the state, such as mask mandates that are slowing the spread of the virus in the state. Sadly, there are still quite a few patients in the hospital, more than 500. There were 466 confirmed cases that were in the hospital in Oklahoma, and just under half of those patients remain in the intensive care unit. So as I've highlighted many times before, when you have more than 200 people a day in the hospital in an intensive care unit bed, we're going to continue to see some deaths in the state until we really get our case counts down and reduce our hospitalizations. The other thing I wanted to highlight just briefly was the survey that was reported by the American Academy of Pediatrics and the Children's Hospital Association, looking at the number of children in the United States that have tested positive for COVID-19. I think there's a broad misperception that COVID-19 is not a disease of children, and that couldn't be farther from the truth. In the United States, there have been almost 400,000 kids who have tested positive during this pandemic. And just in about a 1-month period, there were 179,000 children who tested positive. So I'm not surprised when I hear about cases that are being confirmed in schools, primary and secondary schools in our state, because kids do get this infection. Luckily, they don't get nearly as ill. They're much less likely to be hospitalized, but I think it's really important that people understand that children can be infected with this virus, and we will send out a link to this survey that's freely available from the American Academy of Pediatrics to download. If you want to get more detail, it does include Oklahoma-specific data in that report.
Okay, so how big is the risk of sending kids back to school now that we're starting?
Well, I think, so the question is about the risk of sending kids back to school. And as we've talked about many, many times, anytime you bring people together inside, particularly indoors, and you have density of people, you can increase the risk of transmission from one person to another. Remember, kids may even be more likely to be asymptomatic if they get this infection than adults. And so a kid could pick this infection up at home or in some other setting, go to school, have the infection, they may shed the virus and not have any symptoms at all. So again, I think we just have to be realistic that there will be kids that come into the school that test positive for COVID-19. The most important things that we can do are those public health interventions that we've talked about so many times to try to physically distance the students as much as possible. Certainly anytime they're in transportation on a bus, and certainly in the classroom, they should be in a mask. I strongly encourage parents, whether the school has a mandatory policy or not, to teach your kids how to use a mask, wear it. and teach them the importance of wearing a mask to protect themselves, but also to protect the kids that are around them. That's how we slow the spread of this particular virus, and that will make the school experience safer. As I've highlighted a number of times, most schools have done a very, very good job of enhancing disinfection protocols, cleaning, and many have developed programs to keep kids from congregating in large crowds, like in a cafeteria, by having them eat in their classroom so they can physically distance as much as possible.
What do we need to remember as we send our kids back to school?
Well, again, I've been a strong advocate that we need to have mask policies. I've been working with a team here in Oklahoma, represented by the Oklahoma chapter of the American Academy of Family Practice and the Oklahoma chapter of the American Academy of Pediatrics. And we've made recommendations to the school boards and others about opening classrooms safely, and those include very explicitly doing all those things we talked about, but in particular making sure that everybody's in a mask, which includes faculty, staff, and students, to prevent spread of the disease.
It took about 4 weeks for Oklahoma City to start seeing the effectiveness of the masking ordinance, and that ordinance expires Labor Day weekend. Do you feel it should be extended so we see continued positive results?
Yes, I feel like, I've been asked, how will we know when we can stop mask mandates? And I just don't see that in the immediate future, because I think all of us are concerned that as schools and campuses reopen, we may see some uptick in the number of cases. And so I think we need to maintain our vigilance. As I said this morning, we cannot take our foot off the gas. We're seeing the trends we want to see, a reduced number of positive tests, fewer new cases that are being confirmed in Oklahoma. But I think that's largely because we're doubling down on some of those policies, particularly the mask ordinances, and I'm certainly hoping that we don't let them expire and watch counts start to trend back upward again. So one of my colleagues over in the College of Public Health feels like, the reality is until we get broad distribution of a vaccine, we may just have, wearing a mask may be the quote new normal for quite some time, maybe another year, maybe 2 years, until we get enough of the population that is immune to this disease that we don't see it spreading like we have in the past.
When it comes to hospitalizations, overall numbers are steady or slightly down, but health experts on a call today said new admissions are up, which is concerning. What are your thoughts on that?
So, I watch the hospitalization data every day, and it's bounced around quite a bit in the state. So at times I even wonder if there's complete data that's being reported. So I think yesterday or the day before we saw a jump of almost 84 cases. But when you look at the overall trend in Oklahoma, we've plateaued the number of hospitalizations in the state. We still have a substantial proportion of those patients who are in the hospital that are in an intensive care unit bed. And again, that just means that we have some really sick people. You have to be sick from COVID-19 to justify hospitalization, because the majority of patients can be cared for at home, or a lot of them, as you know, don't have any symptoms at all. So I think we need to watch hospitalizations very, very carefully, and if we start to see the trend in hospitalizations going up, then we may have to rethink some of our interventions to try to slow the spread of the disease.
What do you attribute the downward trend to?
Well, the downward trend in the number of new cases I attribute largely to enhancing our awareness of the public health practices that prevent the spread of the disease. I just don't know of anything else we've done that would account for reduced number of new cases. We've seen this virus cause extensive infections in warm climates, so states like Florida and Arizona, Texas, have had huge outbreaks of the disease. It doesn't appear to be seasonal at all. And so I just don't see anything else that we've done other than there are more than 14 communities in Oklahoma now that have mandated masks. Many of the large corporations like Walmart and Home Depot and Costco and CVS and Walgreens, the list goes on, and some local businesses have required mask in those particular businesses, which I think has brought mask mandates to many parts of our state that haven't passed city ordinances or other things. So Walmart, there's a Walmart in many, many communities in Oklahoma as an example, and they mandate masks now to come into the store. And so I really give them credit for helping us stem this tide on a national basis, because we're seeing nationally the total case counts slowly come down. And I think we need to keep up those practices. If we let the gas off again, I think we're going to go backwards again.
With in-person schooling starting, do you expect to see an increase in cases?
With in-person, I think, as I've said many times, kids will be infected. They may have no symptoms at all. They will go to school, and I think we will see some intermittent community outbreaks or school outbreaks with COVID-19. I think it's almost inevitable. And again, I don't blame parents necessarily if the kid has absolutely no symptoms. It's just part of the way we know this particular virus has been able to spread so easily, because people without symptoms can actually shed the virus and spread the virus to other people. So I think that's very important to remember. I think we need to watch very, very carefully what happens in the state, because we may need to rethink some of those policies on opening if we see outbreaks occur.
Where do you stand on hydrochloroquine?
Hydroxychloroquine, Plaquenil, the drug that's used to treat rheumatoid arthritis. There have been now multiple randomized controlled trials, the gold standard scientific studies that have shown that it does not prevent the disease or improve patient outcomes. And in fact, because of the side effects, remember, a lot of patients who get COVID-19 do get inflammation of the heart. That's been proven now. And hydroxychloroquine has cardiac side effects. And so there just isn't any good data that it should be used either for prevention or for treatment at this point. When you look at randomized trials, the gold standard type of medical study that tells us whether something works better than nothing at all. That said, there are a few clinical trials that are still going on with hydroxychloroquine. And again, I keep an open mind. If some of those trials studying different patient populations or catching patients earlier in the course or late in the course show benefit, then certainly I'll support the use of the drug. But right now, we just simply do not have any evidence that it will improve patient outcomes.
Commissioner Fry announced today the Safer in Oklahoma Health Advisory. Do you think this will be helpful?
I listened to the press conference where the governor and the commissioner talked about the Safer in Oklahoma initiative yesterday, and I applaud certain aspects of it. I certainly applaud that they made it clear that we need to do better at physical distancing, social distancing, hand hygiene, wearing masks, so I applaud that. What they specifically recommended, however, was that if you're in a county that's either red or orange on the state's risk map, that it's recommended that you wear a mask. I'm looking for something a bit more forceful, such as a mandate, that if you're in a county where there's substantial community spread of the virus, we need everybody wearing a mask, and we will slow the spread of the virus. And the good news is multiple studies now have shown that if we slow the spread of the virus by wearing masks, you can save people's lives, which I think is the most important reason to do it. Again, it's an act of courtesy, protect the people around you, but there is good evidence now that when you reduce the spread of this disease, and when you use masks to do that, you can reduce the number of deaths from this disease. So I like the concepts that are in the Safer in Oklahoma. I just would rather see mandates for counties that have substantial community spread of the virus.
And the last question we have so far, yesterday Governor Stitt said the 7-day rolling average is at its lowest level in 3 weeks. Should we be cautiously optimistic, and do you have any idea what would be contributing to the decline? You've kind of answered that.
Yeah, we've talked about it. So as I mentioned, it's even lower today. It was, I think, 672 in his press conference yesterday. And when I just checked it today, it was 663. The trend has been consistent. As I mentioned, 2 weeks ago, right at 2 weeks ago, we were at 1,100 new cases a day on average being confirmed in Oklahoma. 663 today, that's definitely the trend. But again, we've seen it happen before. If we let our guard down, if we quit practicing social distancing, if we take our mask off, then we will see those case counts start to trend upward again. So now's the time, if we want to get through this, get over it, really get the case counts down, we all need to be practicing all of those public health measures that actually been shown to reduce spread of the virus. And so that's why I'm still strongly supporting policies that put masks on, require physical distancing, reduce crowds, things like that.
Very good. Anything we didn't ask you this week that you'd like to?
No, I think those are the main points that I've been promoting this week. The news is good. It's really nice to be able to talk about downward trends for a change.
Very good. Thank you, sir. And we'll talk to you next week.
Okay.